Alrighty. So my name is Ebony Caldwell, and I am a resident psychiatrist at Howard University Hospital, and I am a behavioral health ambassador for the HBCU C.A.R.E.S initiative on the campus of Clark University. I am here with Dr. Danielle Hariston, who I will be interviewing for my social media interview. So, Dr. Hairston, can you tell us a little bit about yourself?
Yes, my name is Dr. Danielle Hairston, or a doctor named Danny on the socials, and I am a psychiatrist, a consultation liaison psychiatrist to be exact, and assistant professor and residency program director at the Howard University, in Washington, D.C.
All right, thank you so much, Dr. Hairston, for joining us today. So can you talk a little bit about what interested you in becoming a psychiatrist?
Yes, I think that I've always been interested in people's stories about how they've gotten to the places that they are and how they interact with each other, how mental health is affected by all aspects of life, including medical conditions. So in medical school, I was really torn between internal medicine and working with HIV and infectious disease, and then also understanding people's stories a little bit more in depth and understanding their psychiatric issues, their mental health issues, and how all of these impact their health. So I learned about consultation liaison psychiatry. I learned about a even more subspecialty HIV psychiatry. And that's how I decided that this was a good combination of all the things that I like and all the things that I'm interested in, from human behavior to medicine to social and economic status, how things like wealth and education impact you. And I think psychiatry and mental health is the only specialty that really does that.
And what's the most exciting and challenging part about the work that you do?
The most exciting part is, again, I said I am a consultation liaison psychiatrist, so I move all around the hospital, from labor and delivery to the emergency room to the ICU, anywhere that someone has a psychiatric issue. And so I think the most exciting part of my job is that I never know what's going to happen. It's never a dull day. Dr. Caldwell, you know that it's never a dull day on consults. So I'm always doing something exciting, always learning something from our patients, from my students, from our residents. So it's always exciting. It's always moving. There's always some type of innovation, something new to learn. So I like that. I don't like the same thing every day. No shade to anyone who does like outpatient or inpatient, but I like to get to learn something new, see how different medical issues impact your mental health. So yeah, that's what's exciting. Now what's challenging is it can weigh on you. Like, it can be exhausting to have to talk all day, to learn about some very traumatic issues, to think about things like suicide attempts. Sometimes patients are extremely psychotic. Sometimes they can be aggressive, agitated, traumatized, and to see a lot of this trauma day in and day out, that can be exhausting. And if you don't have boundaries and a way to take care of yourself, they can be extremely challenging.
Understand that. And how did you come to be in your current position?
Well, that is interesting. It's an interesting story. So I've always liked teaching. In residency, I was a chief resident and I was in charge of like education and didactics. So I always knew that I wanted to teach. I wanted to do academic medicine. Now, did I think I was going to be the youngest psychiatry program director there is on the scene right now? No. I thought that I was going to learn to do this gradually, but the opportunity arose, and I think a lot of the residents and also other students and faculty, but in particular residents who had worked with me when I was chief resident, and faculty members when I was a resident, asked me like to come back, and I knew that this was something I wanted to do ultimately. So here I am. I was a little just thrown into the fire in this position, and I'm still learning. So yeah, that's how I came into this position of being a psychiatry residency program. I think program director, I think I entered this position at 34 years old. And it was and has been a lot, but I'm learning as I go.
And what was your experience and journey like through medical school?
How long do we have? So my residency, I mean, my medical school journey was not easy. I had a lot of challenges in medical school, which were hard for me to really mitigate and understand because I had done like extremely well in high school. I, I killed high school. It was easy. SATs, okay, that that exam. And then I went to undergrad. I had a very supportive program. I went to undergrad at Rutgers, and I had a very supportive program that was for minority students or underrepresented minorities in medicine. So it was like a year, multiple year long like boot camp that I had tutoring. I had MCAT prep courses every single Saturday. Like my advisor, Dr. Khan, was like, you got to eat your books, you got to sleep with your books. So, I felt well prepared. And then when I got to medical school, it was just like, I couldn't understand. Like it was a different teaching style. And I definitely had a lot of struggles with my exams. I had to repeat exams. I had to go to summer school. That's not, I did like voluntary summer school to get more credits in undergrad, but I didn't think I was ever going to have to go to summer school. So I had to take exams over, and medicine is a lot about scores and exam scores, and it has a great impact on your confidence, on your abilities to do well, and on how you feel that you will do clinically, on how strong you feel about being able to provide patient care, if you feel like you're actually meant to be here. So imposter syndrome is greatly informed by these scores in medical school. And I think that hurt me a lot. And I had to learn to protect myself, protect my own mental health by doing things like going to therapy, counseling, doing things outside of medicine. So medicine was not just my whole complete life, because it can really take over. So my journey was hard. Like I did not do well on my USMLE Step 1 exam. And I was like, I had to take some time off. I was not going to finish with my class. It was just all of it was really shocking to me after doing, very well. I got into the medical schools I applied to. So it was a challenge, but then I bounced back. I learned how to study in a different way, like how to study for exams, because I know as much information as anybody. Like there's nobody who could go toe for toe with me in psychiatry. But I learned that having to be confident in myself, learning that I deserve to be here, it was a big deal. And my journey was definitely not easy. It wasn't like a straight path. I had some gaps, some fallings, some shortcomings, but now I'm a boss and there's nobody who could tell me anything about Step 1 or anything different. I know plenty of people who did great on their exams, and they're not as strong a clinician as me. So I've learned that just how to play the game of medicine now. There was a time when you used to say Step 1 and I would start crying. Like I just couldn't help it. It was just so traumatizing to me. That was a lot. My answer, but so yeah. Then Howard University took a chance and I matched here for residency, and I felt like I cared about this community. I gave back to the community as a resident. And so it wasn't that challenging for me to decide to come back here to give back to the residents and the students as well.
Thank you so much for sharing. And to wrap us up, what advice do you have for students wanting to pursue a career in psychiatry or in any other mental health field?
You deserve to do this. You can do this. If you hear no from this place, from this place, from this place, keep going. Like if this is something that you truly want, I am a perfect example of how someone has told me no. People ask me like, do you think you should maybe leave medical school because of an exam? Like it's so much. So take care of yourselves. Believe in yourself. Make sure you have a support network because you're going to need that to fall back on. Make sure you have mentors. Shoot your shot. Like if you see, not me, because I have 1,000. I literally have 8,000 emails right now. But if you see someone out here, visibility is important. So if you see a Black psychiatrist, shoot your shot. There's not that many of us. Like, just send them a message, email them, ask them, can you call them? Ask them, is there anything that you can join, any networking opportunity, any research opportunity. Like, you got to put yourself out here, because this system was not meant for you to succeed. So you need all the support that you can get. You need all the drive that you get. It's going to take a lot. You need all the drive. And even when you're getting here, it's going to take a lot for you to even feel like being a resident, being a psychiatrist. Like, every day sometimes you gotta pull yourself up and be like, all right, I'm gonna do this because I remember who I am. So my advice is, if you want this, do it. It's your job. Like, until you get into it, do everything that you want about getting into this field, do it. Like, you gotta eat, sleep, run, whatever it is, you got to make sure that you do that so you can get to this position if this is what you truly want. Reach out to others who look like you, because there's not enough of us, and we all need to build a community and network. So somebody knows somebody. I know everybody. So make it happen. Don't give up. Persistence, perseverance. I can't even talk. Cut that out, Ebony. Dedication is a key. You're meant to be here. Don't let imposter syndrome break you down. You can do this.
All right. Well, thank you so much for joining us today, Dr. Hairston. This was really great. You have a great rest of your day.
Thank you. You too. I'm going home now. Goodbye.